Follow these instructions for proper specimen capture. The specimen collected should be performed by a healthcare professional who has completed training and demonstrated competency. It is always important to read the manufacturer's package insert for specific specimen instructions regarding specimen collection and transport for the type of test kit being used. In addition to collecting the specimen correctly, it is imperative that personal protective equipment, PPE, must be worn at all times when collecting a respiratory specimen. PPE includes lab coat, mask, surgical, medical, dental procedure, isolation or laser mask, eye protection, and gloves. This equipment must be worn at all times during a respiratory specimen collection. Next, check for nasal obstructions. Open the eSwab sample collection pouch and remove the tube and swab. Collect the sample from the patient by doing a nasopharyngeal swab with a swab included in the kit. Gently insert the swab into the nostril, keeping the swab near the septum floor of the nose. Gently push the swab into the post-nasopharynx. As a point of reference, the swab should be inserted about half the distance from the opening of the patient's nostril and the ear. Rotate the swab several times and then gently remove the swab. Perform the test according to the manufacturer's instructions. Unscrew and remove the cap from the eSwab tube, making sure not to spill the medium. Break the swab off into the tube as follows. With the other hand, grasp the swab shaft at the very end with the thumb and first finger. Lean the part of the shaft with the breaking point against the rim of the tube. Bend the swab shaft at a 180-degree angle to break it off at the colored ink breakpoint mark. If needed, gently rotate the swab shaft to complete the breakage and take away the upper part of the swab shaft. Discard the broken handle part of the swab shaft into an approved medical waste disposal container. Replace cap on the tube and secure tightly. Write patient information on the tube label or apply patient identification label. Package the specimen in the included biohazard bag, along with the requisition signed by the ordering practitioner and the patient's demographic information. Place all of the specimens that have been packaged in biohazard bags into the provided proximity healthcare bags and place those bags inside the FedEx shipping box. Do not freeze specimen. Ideally, the specimen needs to be shipped by 7 p.m. the day they are collected. If for some reason the specimen cannot be shipped immediately, you may refrigerate the specimen overnight and ship the next day.